So there's actually a project board that's been set up to deliver that, and we're hoping that it'll be up and running by the summertime. There's a huge amount of work to be undertaken between now and then, and part of that is a really robust community consultation with residents and businesses in the area, and also working through the logistics of how the service will operate. I'm quite sure that we'll see that operating as soon as we possibly can. And we know that this is going to be one of the measures that we can put in place to reduce harm, especially for those individuals who are finding themselves injecting in a public space in really unhygienic circumstances. So it's to give some dignity back to people, but also to reduce harm. And that's not just from the drugs themselves, but that's from things like HIV, and that was one of the big drivers for the discussion around safer consumption facilities in the first place. I think what we need to think about is we're still doing this within the confines of the Misuse of Drugs Act and the legislation as it is, and that means that the Lord Advocate herself has to be satisfied that the parameters that she set out, Glasgow Health and Social Care Partnership will have to meet before she will issue that statement of prosecution policy, which would mean that it wasn't in the public interest to prosecute somebody for possession within the confines of such a facility. I would say that I would ask the UK government to devolve the powers to us so that we can expand on that, but I'm quite confident that with that service up and running we will see a reduction in harm.